Wow, you have a very low heart rate.
Yes. When I was born, I had an atrial septal defect. Do you see my scar?
Still tender?
Not so much.
I do feel like either way, even if you are cleansing or leaky gut, either way, there's some fasting in your future. How much stretching do you do before you lift? Not enough, obviously.
Minimal.
This visit's over. I figured it out. Chiropractic medicine. How's your diet?
I'm really great during the week, but on the weekends when I travel, it's awful.
Okay.
I eat a lot of fast food.
Okay, fast food is definitely inflammatory, not going to help with chronic back
Yeah.
condition. All right, you're going to have to learn how to pack.
Yeah. Yeah,
You
I
need your
know.
car
I already
snacks.
know.
You need lemons and limes, grapes and strawberries.
Okay.
Hold on to me. That's good. It means you're relaxed. Wow, you have a very low heart rate.
Yes. So when I was born, I had an atrial septal defect. Do you see my scar? Yeah, I had open heart surgery to have it repaired. And so I have POTS.
Okay.
So my blood pressure can skyrocket, and I have a low heart rate. Yeah, and it causes me to pass out sometimes.
When you switch positions.
Yep, I can go from laying down to standing up really fast, and I'll black out, or sitting down to standing up really fast, and I'll black out. It doesn't happen often, but it has happened. Can't do roller coasters or anything like that.
All right. You were born in 85, right? Okay. No roller coasters, I'm sorry.
Yep, I'll be done blacked out. The test for POTS was awful.
Yeah, the table tilt test?
Oh, God, yeah. I blacked out like 5 times. And then they did this chair thing where you're sitting up, and then they just drop the back of the chair, like, really fast. And they have, like, you have to wear these goggles, and they look at your eyes on the computer screen, and my eyes would just vibrate like that whenever. And now I don't ever notice it, but to someone who knows what they're looking for, they could see that.
Okay. Is this tender?
Yeah.
Okay, this is a pressure point for the gallbladder, so I'm going to palpate your abdomen now, okay?
Okay.
Yeah, so they split your chest open, huh?
We call that scar
Zipper
a
glove.
zipper. The
Yeah.
zipper glove, yeah.
You're in the zipper glove. It's just you and a bunch of old men.
Yep.
Okay. Any other inflammatory things happening? Alcohol.
No, I don't drink a lot.
Nicotine.
Nope.
Okay, good. Coffee.
No.
Okay, good. You're doing great. Well, you probably travel frequently, right?
Yeah, I do. Yeah, just about every weekend. I do have leaky gut.
Who diagnosed that and when?
I kind of diagnosed myself just from doing my own research. My stomach constantly makes noises, and it's so embarrassing sometimes. And it's loud too. And I'm like, I don't want that. I'm not hungry. I'm not sure why it's doing that, but it's making all kinds of noises.
Do you have dietary restrictions?
No, like allergies. But I do try to stay away from like eating a lot of dairy.
Got it. All right, I'm going to palpate the ileocecal valve, okay? It's
Okay.
just beneath your band right here. So here's your ASIS, and then just right there, we're just start tracing up towards the belly button. Tender there, right?
Mm-hmm.
Sucks. Okay, nice belly breathing. Good, yeah, breathe into your belly. You allergic to any medication?
Just codeine.
Okay. So you stay away from dairy.
Mm-hmm.
What other symptoms of leaky gut do you have? So you have fatigue?
Yeah. Yep.
How's your period? Is it on time? Normal?
Yeah, it's pretty normal.
Okay, I'm going to palpate underneath the rib on the left. Okay, nice belly breathing. Breathe into your belly. More belly, less chest and shoulders. Yeah, really push your belly out as you breathe in. Good. Good deep belly breath. Is this one tender?
Not
as
so
bad.
much as the
Yeah.
other one.
Still tender over here?
Not as much as it was before.
All right, I want you to take both your hands like this, put your other hand up too, and just like hold and spread.
Okay.
Okay, I'm going to contact your sternum. Tender?
Yeah.
You ever do bone broth?
No, but I've been reading up on that.
Okay, so you diagnosed with you diagnosed, self-diagnosed leaky gut. Are you self-treating your leaky gut?
No, I don't know how.
Okay.
I mean, I've seen so many different things, but I don't know which one would be best.
Start with
I mean, I've looked into peptides.
Okay, good. Peptides. I have a peptide protocol I can share with you. Elimination diet is really important. Bone broth. Probiotic?
I don't take a probiotic.
Have you ever?
Yeah.
Still tender?
Not so much.
Is this still tender?
No.
It's okay?
Yeah, it feels pretty good.
Maybe you don't have a rib out. Maybe it was just the reflex. All right, I'm going to do another manipulation, but this one's to your cranial cavity, and I'm going to contact the upper jawbone, okay?
Okay.
All right, so smile with your teeth. Okay, now let your unsmile, or just let that relax, yeah. Let your jaw relax. Okay, I'm going to hold this bone right here in this direction like that. And close your eyes. It helps you relax a little bit better. And it kind of looks weird. There you go. Nice deep belly breathing. Good. We're going to hold this for 3 breaths. Okay, now smile. Or say ah. Okay, relax your jaw. You drink enough water?
Mm-hmm.
Okay, ah. okay?
Yeah.
Pressure's still good?
Yeah.
Anxiety and depression and stuff like that.
Yeah.
I know that all of that just works hand in hand with
Okay.
like the gut, and
That's right. You can't.
I've had all of that.
Okay, so fatigue, anxiety, depression.
Mhm.
All right, so but only leaky gut for 3 years, and the sounds were
Well, it's probably been
more.
over 3 years. It's just around 3 years is when I kind of like really started digging into it and learning more about it.
Mhm. All right, so there's a good chance that post pregnancy, hormone changes are also part of this.
Yeah.
And you said you were allergic to codeine. Why?
Well, I don't know if I'm really allergic to it, but every time I take it, like I vomit. Yeah.
All right, so that's your gut saying you can't put this in here because it's gonna go right through.
Mhm.
Yeah. Okay. But did you ever like use a lot of prescription medications or over-the-counter medications?
So after I had my last child, I had postpartum depression, like very badly.
Mhm.
I tried every medication on the market and nothing helped. And so I had all of that medication. Nothing really, like the only thing that works for me is just staying on a schedule, my diet, exercise. Just like medicines just don't do nothing for me.
Okay, that's interesting. All right. So, have you ever done any cleanses?
No. Mm-mm.
I do feel like either way, even if you are cleansing or leaky gut, either way, there's some fasting in your future
Mm-hmm.
for to let the gut heal, and then your low back will feel better too.
Good.
Your low back will feel better. Obviously, if it feels better now, it's obviously, partly mechanical, and it is partly mechanical.
Mm-hmm.
But getting it to a good state where it feels good. Do you take any vitamins or minerals right now?
Oh, Lord.
Next time you come, or even before that, if you want to send me your x-rays.
Okay.
How much stretching do you do before you lift?
Mm,
Not enough, obviously.
minimal.
This visit's over. I figured it out. Jesus, how that could be the last thing I asked. This is easy then. I need to send you a stretching video to stretch your spine, okay? We need to put a range of motion into your spine.
Okay.
And that has to be done at least 5 days a week before you lift. But if you did it every day, you would need me or any other doctor a lot less.